Good afternoon. I'm Steve Rehorst, the Public Information Officer with the Watertown Task Force. Thank you for joining us this afternoon here. Up first, we have Mayor Sarah Karen with our community update.
Good afternoon. Today is April 20th, 2020. In our state, we are up to 1,685 cases. We still have 7 deaths. Cottington County remains at 13 total cases, and now 12 have recovered. The state is posting the number of negative cases as well. We have 372 negative cases in Cottington County, which is 3.38% of our cases are testing out as positive. That's not very many. The state is a little bit higher at 13.67% of the cases testing out as positive. I've been receiving feedback on the emergency resolution and ordinance that the city passed back in March, and I've gotten input on both directions, from people thinking that we should have closed down more businesses to people thinking we shouldn't have closed businesses down. And of course, there's a very good argument for both sides of that. This is something that is of a deep concern to me and to the City Council. We want to do what's right for our community, and we think that the controls that we have exercised are working, and that's why the numbers are low. If we relax, the numbers could go up, but we don't know. And if you would like to help the council decide what to do in these matters, your input is welcome. There's a council meeting tonight that starts at 5:30, and you can watch this council meeting live on the city's website or on GovTV. And if you'd like to provide input, we're doing council meetings differently. They're mostly virtual. Most of the council members and staff members are participating through an app called Teams, but you can still participate in the meeting by calling in. And I'm going to hold up the numbers that you can call. If you'd like to join the council meeting, you can call 605-305-4355 and enter the ID number for the conference, 759-356-747 #. And that will get you in. You can provide your input, and we do want to hear it, and we want to do what's right for our community. So please don't hesitate to participate in the meetings. If you don't want to call in, you can always reach out to your council member or to me, and we welcome that input. That's all I have, and I would like to now introduce Mike Cartney, the president of Lake Area Tech.
Thank you, Mayor Karen. It's great to be here. For Lake Area Tech, this is workday 25, calendar day 38, since the governor gave the first order to close our buildings to the public. And since that time, the staff and students at Lake Area Tech have just done a phenomenal job of moving online and responding to the situation. And we're providing the same high-quality Lake Area Tech education now in a virtual environment. And we have just 3 weeks left until graduation. And that's really important. That means that we, are stepping forward, but we also have a lot of planning to do, because this year's graduation will be our 53rd annual graduation, and it will be a virtual ceremony. It'll be on Friday, May 8th, and it'll be completely virtual, and it'll be at whatever time the graduates would like to get on. In other words, it's not going to be at the ceremony everybody at 4 o'clock, but rather everything will be there, and the graduates can go through the ceremony in their virtual environment at their and their families' leisure and time. And we hope that we've put something together that will hopefully honor not only the tradition and the magnitude of this important event for our graduates, but also that it's meaningful, but it's very special. And we hope to have a couple surprises in there also. This year, our graduation speaker will be Senator John Thune. And we look forward to some other cameo appearances that we hope you'll enjoy. Everybody at Lake Area Tech understands and shares the disappointment at not having able to a live face-to-face graduation ceremony in May. we are talking about potentially having a face-to-face ceremony in the November, December timeframe for those that want to take part in that. So we'll be working through that and seeing what our interest is of this year's graduates in doing something like that. But let me talk about some of the other things that Lake Area Tech is doing along the lines of what's going on with COVID-19. Our robotics department, many of you have heard, Brooks Jacobson, Bob Poor, and Chad Kint are working hard with a number of partners on 3D printing not only facial shields, but also masks, and even some little devices that help so the mask won't wear on your ears quite as much. This all started with a grant from our community foundation, but Terex, Worth Industries, Raven Industries in Sioux Falls has joined in, and they're all working together to print this PPE for our workforce providers, our law enforcement, even some of the other people that are providing other services around the city and the state. So right now they've already produced 2,600 facial shields and 500 masks, but the demand is still out there. In fact, the State Department of Health has requested another 5,000 facial shields and another 500 for Prairie Lakes Healthcare System. And so after we get all those built or made, then we'll start into even building a little stockpile and giving them out to other folks that need PPE as they do their tasks in this new environment. And so some of the key recipients that have received the masks or the shields have been Prairie Lakes Healthcare System, Adventura, the South Dakota Department of Health, Lifescapes in Sioux Falls, Avera in Sioux Falls, as well as the Veterans Administration, both in Watertown and in Sioux Falls. If you want to help, there are some areas where we need some help. What we're having a critical shortage of is elastic, not the big wide bands, but we do need about the 3/8 or the 1/4 inch wide bands of elastic that hold both the masks and the facial shields in place. If you have any of that, or if you have large rubber bands, we can use those. That call continues for that, and so we look forward to working through and continuing to be able to meet this critical need. Our energy department, Scott Lighthizer, Patrick Curley, Brady Brockle, they're all working very hard on hand sanitizer with Glacial Lakes Energy. And then once they produce it, Glacial Lake Energy is providing all the ingredients that go into it. And then Office Peeps is delivering all that in coordination with the Cottington County Emergency Response. This is being done along CDC guidelines, but also with the help of Prairie Lakes, Hy-Vee, Tri-State, and Valley Queen Cheese are providing things like, for example, containers that this all needs to go out into. So we really appreciate all the partnerships that we're seeing, even have Bourne's Group stepping forward to help us print labels that need to go on to the hand sanitizer. And they produce 250 gallons here at Lake Area Tech, but Glacial Lakes Energy as a whole has been the catalyst in providing over 2,500 gallons of hand sanitizer across the state. So really a big effort and a strong thank you to all those. Our building trades program, Kevin Thiessen is working with Prairie Lakes on prototyping some new devices that they hope to see, they hope will be helpful in the hospital to help with control some of the spread, should they be necessary. We actually hope they won't be necessary, but if they are, they'll have this new technology, and we're working hard with them on that. Precision Machining is working on blow molding masks, and they're working with even a company out of Minneapolis, the Minneapolis area called Midwest Cams, Gibbs Cams, and as well as Dakota Automation here in Watertown to be able to produce masks at a much higher volume and rate than what we can do with 3D printing. 3D printing takes about 3 or 4 hours per mask, and when you blow mold them, you can make them in about a minute, and they're a little bit more pliable. So we're really looking forward to that coming online. We're also availing services of not only our equipment where it can be needed, but also we have some highly skilled personnel that are teaching, for example, our nursing personnel, our own master level nurses, but also we have firefighters, we have paramedics, we have the law enforcement students and faculty. So those are all being availed to the response should they be needed for the surge, and a number of our equipment. In fact, the new building that we're just is going to come online here 1 May. That building has new beds going into the new hospital beds going into the simulation centers. Those have temporarily gone to Prairie Lakes Hospital to help them prepare for their surge capacity. So we're stepping forward and helping where we can. And Lake Erie Tech continues to move forward. We continue to innovate, finding better ways to do not only the online, but our education in general. And we're finding that, probably when this, as we go along, we're looking for better ways to do business in general. We probably will not go back to business the way it was. There will always be changes that are driven by this, new ways of doing things. And so we're really capitalizing on this new environment and looking forward at how we can be more innovative in how we deliver education in general. But we stay very vigilant on the basic things of, making sure that we wash our hands, making sure that we are using PPE when needed, that we are wearing masks and so forth, doing the social distancing. Because, I couldn't be prouder of the way our staff and students are doing with this as a whole. We've had no cases in Lake Erie Tech and no cases with our students. And we found I am just amazed at the way this community has stepped forward and really protecting the group that's at risk and making sure that we don't see the widespread and the spread to our elderly population and so forth. And I know that that's coming. It's not just happening. It's coming because a lot of people are sacrificing. And I understand that, and I want to thank people for doing that, because I think it's really important that we acknowledge that there are people that are sacrificing severely to take this approach, but it is for a good cause and good reason. And so, as always, I always end with a thought for just take a moment and think about our healthcare providers, the first responders, and our elected officials, whether it's the mayor, the governor, city council. They're all being put in positions to answer questions and make decisions about things that have never been asked before. And we need to understand that there is going to be debate, and it's going to be those hard questions that they're called to answer. And I'm pray for their strength, pray for their wisdom, and their continued efforts, because I personally believe they're doing an exceptional job. So with that, both the mayor and I will stand by for your questions. Thank you.
Their wisdom and their continued efforts, because I personally believe they're doing an exceptional job. So with that, both the mayor and I will stand by for your questions. Thank you.
Dan Christopher from the Watertown Public Opinion. This is a question. This was something that my colleague was aware of, that someone's been asked, is the possibility of or feasibility of opening up tennis courts. I mean, as part, as part of the the exemptions, I guess. What are your thoughts on that?
Well, I did receive a question about opening the tennis courts, if they would block the doors open so no one's grabbing any doors, and have strict social distancing requirements like every other court, and not to touch anybody else's balls, and to not come closer than 6 feet, not to share anything, and just play tennis with people that you are living with, that sort of thing. And I think that's a really creative solution, and I can't think of a reason why we wouldn't do that, but I'm not going to make that decision without a conversation with the park board. And I think that they would entertain that. So, yes, I think that's a good idea.
Okay. And such timeline as to when a decision either way could be made, or
probably pretty quickly. And I mean, they meet once a month, but we can visit electronically between meetings as well. So.
Okay. All right. Thank you.
Thank you. Any other questions for me?
Mayor, Mike from KWAT. I was just looking back here through some notes. It looks like Cottington County's infection numbers have gone up by 2 over the last couple of weeks, and right now we have everybody that's tested positive in Cottington County has recovered, with the exception of one person. I'm just wondering, Are these numbers prompting more people to get in touch with you and say it's time to get some of these businesses reopened again? I'm seeing, all the news reports that you see too about the protests that are going on in some of the larger cities, and people want to get back to work. How would you kind of characterize things here?
Well, I am receiving messages from people wanting to know when we're going to open up and can we open now? Look, we don't have cases, and but I'm also getting messages from people saying, "Stay strong. We haven't seen our surge yet." And I have to lean very heavily on the medical community, whom I meet with every single day. So the Unified Command Group thinks it's too soon to back off of our controls, but we are actively talking about it, and the City Council will be discussing this tonight. So it's not something that we put in a box and put the box on the shelf. This is something we think about every minute of every day, and nobody knows the answer. We want to do the right thing. We don't want to cause a surge by relaxing on the standards that we've set. It's kind of like I saw on Facebook, somebody equivalated it to jumping out of an airplane, and the parachute opens up and it slows the fall. So do you take the parachute off? We want to do the right thing. So I'm going to say keep on talking to your council members and sending me messages, and we will reevaluate every single day. So do you take the parachute off? We want to do the right thing. So are there other questions?
All right, if there are no other questions, I want to thank Mayor Karen and Mike for joining us today, and especially thank you to our community for donating and spending all of your time and resources. I know I'm grateful as well. I've also received a cloth mask as a healthcare worker, and it's very much appreciated. So thank you, and join us tomorrow at 3 o'clock. Unless there is a conflict with the governor's briefing, then we will push it till 3:30. Have a great night.